Well, good morning. This is Dr. Murray from Murray Natural Integrated Health here in Hastings, Nebraska, doing a short video on allergies and infections. 'Tis the season, right? Got lots of people this time of the year coming in with all kinds of upper respiratory tract symptoms, also extra drippy nose and watery eyes. And just yesterday, I had a patient come in, and they said they were having fatigue, and they said, is that your only problem? They said, yeah, I'm tired all the time. So we started looking at their medications, and they're taking like 2 or 3 medications just for allergies. And so this is a horrible time of the year, awful time of the year for that. And so I said, well, you know what? It could be that, yes, fatigue is an issue for you, but it's actually related to something else. In this case, definitely could be related to allergies or the medications needed to deal with those allergies. So let's talk just a little bit about allergies. A neat website I was just perusing through here recently, and I see that on the AccuWeather under Hastings, Nebraska here, you see that they do have indices here for ragweed pollen and tree pollen and grass pollen and the severity of those. Just this month, you've got very, very high to extremely high levels of ragweed pollen. So, every time of the year is going to have a different type of particulate matter floating around that people can have allergies to. And so remember, with allergies, it's not that your immune system isn't working, it's just working too much. So if there's ways that we can first remove the load, that would be great. But if there's also some ways that we can also calm down the immune system, that would be great too. So regarding just the particulate matter, one thing that we always recommend is, because you can't really change exactly what you breathe, that's tough. But you can also clean out the nasal passageways, because the air you breathe in is always dirtier than the air you breathe out, right? So you're collecting all that garbage, pollen, dust, particulate matter, even cat poop into your nose, and that's not good, right? So you make mucus to either snot it out or to swallow it, and then your stomach acid destroys that. One thing we always recommend is using a nasal spray like Clear, which is one that we use here. You can get this at many other stores as well, but simple, easy, it's non-medicated. I tell folks that if you've got allergies, you should be doing this 2 to 3 times a day. It won't dry you out, and if you just kind of treat it kind of like brushing your teeth, doing it morning and night, that's a great thing to do, because it helps to bring out all the extra pollens and all the other allergens that are in there to remove and reduce the load on your body. Secondly, you can also do something like D-Hist, which is a natural antihistamine. Natural antihistamine has quercetin and stinging nettles, helping to reduce the histamine responses in your body. Now there's other things, of course. I mean, you can also, in your house, if you're not using some type of an air purifier, we have one in the office here, but we also have one at home that helps to kind of reduce the particulate matter floating around in your house, and also perhaps even helping to reduce mycotoxins and molds and things like that as well. So a purifier could be very good, but also dietary changes. Alcohol consumption will increase allergy reactions because it changes the microflora in your stomach. And of course, that's another reason why having a good, healthy stomach is a good thing for those people that have allergies. Your fatty foods and all your processed foods are really bad for allergies as well. So those are a couple things on the allergy side. On the infection side, well, since there is a lot of stuff floating around, people get a lot more mucusy. It also creates like a petri dish in our nose where bacteria and viruses and those things can grow and flourish. So there's lots of things to help reduce the impact that infections can have on your body. One thing is the preventative aspect. So if you're not exercising on a regular basis, that can help with infections, because infection is a stress. Exercise is a stress as well, but a good stress. This strengthens your body and strengthens your immune system. Adequate sleep. It's important to get the adequate sleep. And of course, the hygiene things with washing your hands and making sure you're not touching everybody after you've already sneezed and blown your nose and things. That makes sense. But other things, your vitamin D, of course. Vitamin D, and we have a D and also a D and a K. Good one to use there as well. Vitamin C, of course, that's been used for a long time. Monolorn, which is a good natural antiviral. Even garlic is a good one to use for certain types of infections, usually more bacterial infections, and monolorn more for viral infections. Colloidal silver, we use silver for a lot of different types of infections as well. Bioseed, and there's a couple other antimicrobials that you can use to help out with infections. But one thing that's been used, and we know it has a lot of good studies, are zinc. And zinc, if taken within 10 days, 10 days of starting some type of upper respiratory viral infection, can reduce the length of that infection. Many studies have shown that. And so there's this kind of one of my two go-tos when I'm having to talk with patients. I'm just feeling a little bit under the weather, a little scratchy throat or something. I'll use either elderberry and zinc or echinacea and zinc. And those both the zinc has some antiviral properties. And used in connection with quercetin, which is what they call an ionophore, and it shoves zinc basically into the cell and helps the cell to actually utilize zinc a little bit more effectively. It's a great regimen, a great thing to have during a cold and flu time. And now also regarding infections and also allergies, you can test and you can actually see which is more likely, what's going on here. On your white blood cell counts, for instance, you can see whether your eosinophils are high or your lymphocytes are high or your neutrophils are high. All those paint a different picture, whether this is a bacterial infection or perhaps a viral infection or perhaps even an allergy or sensitivity. So a lot of good things to do to kind of look and check, and especially with infections. If you're having high fevers, if you're also having respiratory tract involvement, oh boy, you do need to have that looked into. We do some strep testing here as well and do some other infection testings here too, which is good because, like I said, not to test is to guess, but to test is to know. But also with the allergy side, you can do food-related sensitivities because you can't control what you breathe, but you can control what you eat. And there are many people who some of the foods they're consuming, there's an allergen load from that, and it's making all their other allergies worse as well. And other people, they have this chronic infection thing that keeps on coming back and keeps on coming back, and they just can't get rid of it, and they don't understand what's going on. Well, one reason could be is because either their hormones are off and they're not healing like they used to, or their nutrient deficiencies. They have some true nutrient deficiencies. I had an individual the other day who was having chronic pain and also a lot of chest discomfort, found out that their thyroid was not working correctly. So they dealt with their thyroid, and those symptoms just went away, because the thyroid just kind of affects everything. So it's important, not to test as to guess, but to test as to know. But it's important to address those foundational things, those deficiency areas, those inflammatory issues, especially when we just don't know what's going on. You got to test. You got to test for it. So allergies, infections, lots more to be said about that. But that's what we do in our office, is we actually get to root causes of the problems and actually give some conservative, naturally minded approaches to help protect people so their body can actually heal and repair like it's designed to. From heavy metal testing to nutrient deficiency testing, hyperbaric therapy, IV-related therapies, all kinds of therapies and help for folks that are struggling with those conditions. So if you have any questions, don't hesitate to give our office a call at 402-463-4257. And as I always say, try to find one thing to do today to get yourself healthier than you were the day before. And if you do that every single day, by the end of 30 days, you will be amazed. It's Dr. Murray, Murray Natural Integrated Health, setting the standard in natural health care. Have a blessed day.